What is up, guys? Thanks for joining me for a quick live here. If you like to start, please share below, leave me a comment. Today, I wanted to just kind of go over something. When I do the coaching on the EMS exam formula, I always try to kind of bring it home and give people a little bit of focus and give them sort of the quick tips and kind of nuances that helps them focus a little bit, right? So one of those things that I remember seeing on a video not too long ago that kind of clicked on my head, and I had made a note about it. I wanted to do a video about it and just kind of focus on that one segment is when we talk about things like mental status on patients, right? Now, when I talk about mental status, this can be used when you're evaluating a question you're trying to answer, right? On a test, whether it's a national registry test, a final exam, whatever the case may be. But you can also kind of use this when you're thinking about when you're assessing your patient, when you're doing your practical skills, things like that. Okay. So when we talk about mental status, we want to look for clues in the question, or when we're talking to our patients, when we're doing our assessments, looking for clues that kind of indicate the patient is having an altered mental status, right? Maybe the family's going to tell you he's not acting right. Maybe he or she is yelling a lot, right? Maybe they're being very anxious. Okay, uh, you know, things like that you're not going to kind of see with somebody who is alert. They times four. Okay, so whenever you see anything in the question, or when you're again assessing your patient, or you're doing your practical skills, and the instructor's giving you kind of key points that when you're asking about how the patient's reacting to you, right? Whenever you see anything outside of normal, then that means that they're altered. Okay, keep that in mind because it's a way that the exam question will give you that clue that you need to be looking a little further, paying attention to what else might be going on with the patient. And again, I'm not repeating myself, but this is also good when you're assessing your patient. If your patient's not acting right to you, and the family's telling you he's not acting right, or the caretaker's saying that he or she is not acting right, then take that as a clue for you during your assessment that you've got to look a little further. You got to figure out what it is that's going on. Now, there's lots of things that can cause an altered mental status, right? They could be hypoglycemic, they could be hypoxic because of respiratory issues, right? If the patients have respiratory issues where they're going to failure, they might have that a decreased depth of breathing, a decreased rate of breathing. Okay, so by the time the patient is at that level of distress, they're probably not going to be in a normal mental state, right? They're going to be sort of started getting a little bit confused. They might just be anxious, right? And keep in mind, someone who's anxious could be that they might be having an issue like signs of shock or something, or maybe they're having a stroke. Okay, lots of things that you can look at that could be causing the altered mental status. The key, I think, when you're reading questions and when you're doing your assessments and you're doing patient contact is that if the patient is a little altered, right, it's a good indicator for you as a provider that something else is going on, right? And if they're just, well, there's no such thing as a little altered, right? But if they're a little bit altered where they're just not quite making sense, and of course they don't have a history of dementia, or don't have a history of Alzheimer's, something like that, that might put them in a normally confused state anyway. But if this is sort of a new onset type thing, then as a provider, you take a step back and say, okay, what is it that's causing it? Asking more questions. Now, when you're looking at questions on exams, you don't always get all of the information, right? They can only put so much info in a scenario, right? So what you have to do when you're taking the questions, when you're looking at the questions, is just take it as an indicator that they want you to recognize that the patient is not in a normal state. Okay. So if the patient has any kind of indicator in the question that it's not a normal mental status, then that means when you're looking at your answers, you're looking at what might be going on, what they want you to rule out, what kind of treatment they want to give, that you have to kind of figure, okay, what am I looking for that might be causing this altered mental state? Okay, so keep that in mind when you're looking at questions, you're reading questions, you're looking at answers provided, right? Now, the patient has a just if you in the scenario, the patient's got a genuine complaint, they can actually express what is going on with them. Okay, then they have a normal mental status, right? So now you don't have to worry about it. Okay, but if anything other than that is going on, those should be the clues to you that there's an altered state going on. And then going further into the scenario, further into the question, it should give you the clues and kind of let bells go off in your head that, okay, it's telling me I just came across a 45-year-old female who's extremely anxious, or a 45-year-old female whose nursing aide is telling you they are not acting right, right? So, right there, you know that there's an altered mental state going on. So, now as you read into the question more and start considering what's going on with the patient, thinking about what your answer might be, you have to realize, okay, this is something that's an altered mental status. So what am I looking for, right? But if they have just a straightforward complaint, my arm is broken, something like that, then they're in a normal mental state. So now you know that's kind of out of the way. It's just like when you do your actual assessments on patients out in the field. Okay, as soon as you start talking to your patient, you're going to realize that the patients are um, normal, right? They're meditating fine, they're conversing with you fine. But now if your patient's kind of talking, off, kind of kilter a little bit before you even get to saying, oh, what's your date of birth? Who's the president? What day of the week? Before you get all that stuff, right? Just conversing with them should start giving you an indicator that they might be altered. Now, like I said, you can't do that when you're doing an assessment, okay, on paper, okay? You can't do that when you're doing an evaluation, when you're doing your patient assessment skills, right? And the instructor's just giving you certain indicators what might be going on, right? But when you're looking at questions and things like that, that's when you have to kind of pay attention to that and keep an eye out for it, guys. And when you see something that is giving you some sort of an indicator that the patient is altered, let that little bell go off that you have to start looking for other things that might be going on with your patient, and to kind of alert you that, okay, this question is giving me an altered patient, so I better be on my toes. I better be ready to start looking at things and what I have to look for. Okay, so I'm gonna end it there, guys. I hope it makes sense. I hope it, again, these are quick tips, and it's stuff that when I get people in the coaching and they join me in the exam success course, that when they're struggling and they can't quite put it together, these are one of the things that I'll try to help guide them in order to help them figure out what the right answers are and how to figure out what the right answers are and not get sidetracked by something else inside the scenario that might have them drift, right? Because with the exams nowadays, National Registry especially, right, they want you to think. They don't want you to just regurgitate stats, okay? Now, there might be questions like that on the exams, but more often than not, guys, nowadays, they're looking for you to think critically, to think clinically, okay? And this is one of the things that you'll see on exams that are going to help you get the right answer faster if you're alert to it, okay? And if you let those bells go off, that something else is going on with your patient. So, guys, I hope, like I said, I hope it helps. If you're interested in the formula, I'd love to have you there. Again, there's a bunch of videos that is going to help you, along with weekly coaching with me, practice exams. You can go check it all out. It's at emsseo.com/formula. And I think you will find it could be very helpful for you if you are struggling with your EMS exams. And actually, it can actually help you, even just taking the course, to build your knowledge base and give you some more confidence taking any exam, even to boost your score up a little bit. So go check that out if you're interested, guys. As always, I appreciate you so much for joining me on these lives. Willie, I see you in the chat again. I so appreciate you, taking the time and joining me as well, leaving a comment. Any comments, concerns, guys, you can post them in the comments here. You can DM me. I answer the direct messages, whatever, however you want to get in contact with me. Need some help, need some guidance, I'll do what I can to help you out. So go do that, guys. Until next time, as always, I'm Jim Hoffman from emsseo.com. Stay safe.